All right, it's Chet Mays here with another plastic surgery roundtable. I have two great guests, Dr. Bradley Calobrace and Dr. Jonathan Cook with me here today. And today we're talking about cheek fillers. What do we need to know? Are each of you using cheek fillers in your practice?
I've never used it. No, I'm just kidding. I'm just kidding. Yeah, I've never used one. You know, when I came into practice 25 years ago, we were doing mostly lips and nasolabial folds. You know, the folds here, that is what we did. And I think over the last definitely 5 to 10 years, we became much more about mid-face volume restoration, global volume restoration as a way of creating youth. So it has become probably the most important injection that we actually do today in our practice.
Yeah, I think that there's a kind of patient who used to point to that line in the nasolabial fold and say, can you make that go away? And that has changed to, can you accent the cheeks? Can you give that sort of the OG prime curve, the S curve of the face, which I think is a really nice look.
Yeah, because you're really trying to build that volume that they've lost. The deep fatty compartments, or the superficial fatty compartments, we're really trying to build that back in. And you know, building from the cheek down, just like you said, Jonathan, where you sort of want to build this up and pull and lift, I think that's a great place to start. And then we work our way down on the face. Yeah. Because it's about that building the facial volume back and using these fillers like hyaluronic acids.
Does anybody believe that upper face filler lifts the jowls in the face, or is it an illusion? Does it really lift? Jonathan, I'd like to hear what you say.
So, there was a paper in PRS that reviewed this topic.
Yes.
I came away feeling supported in my belief that it doesn't provide a whole lot of a lift. I think if there is an effect, it's minimal.
Yeah.
Yeah, I would find it hard to lift the entire face with a cheek filler. I like to put the filler into the cheek and build my way down with other fillers in the nasolabial folds, the marionettes, or adding some Sculptra to stimulate the collagen and elastin. So it's a multimodality to get that result. Inject the tree, that's the key concept.
Yeah, I remind all my patients that early aging is loss of volume. And so when we restore volume in people with early aging, it works beautifully because that's the only thing that's created their aging. And they look like they're fully rejuvenated. However, as they age, you have sagging. And trying to treat sag with volume is a horrible idea because it takes a lot of volume. They look crazy and they look over volumized, and I think that's a bad thing.
That wraps it up for a roundtable on cheek fillers, what you need to know.